Prime Minister of St. Martin, Silveria Jacobs, National Disaster Coordinator and ESF 4 Coordinator, Fire Chief Clive Richardson, ESF 5 Coordinator, Chief of Police Carl John, ESF 6 Coordinator and Head of Public Health, Fenna Arnell, ESF 7 Coordinator and Secretary General of the Ministry of Public Health, Social Development and Labor, Joy Arnell, ESF 10 Coordinator and Secretary General of the Ministry of Tourism, Economic Affairs, Transport and Telecommunication, Miguel de Weaver. Members of the media, ladies and gentlemen, good evening. I'm Relika Roach of the Department of Communication, and on behalf of the Prime Minister and Chairlady of the Emergency Operations Center, the EOC, I welcome you to this virtual press conference with regards to the state of affairs surrounding COVID-19. For more on this subject, I would like to invite the Prime Minister of St. Martin, the Honorable Silveria Jacobs, to address you. Prime Minister, you have the floor. Unmute your mic, please, Prime Minister.
Sorry. Good afternoon. Yes, I had my script in front of me, so I missed that opportunity. I want to say thank you to you for the warm introduction and to my panel of professionals who have joined me here as we do once per week. Unfortunately, we were unable to do so yesterday as we were still busy in several meetings that were necessary before we could come to the public to update them about some of the changes being proposed. I would like to say that I will give a short introduction, but when the ESF coordinators get their turns, they can go more into depth. Yesterday, May 8th, we held a full EOC meeting together with key ESF coordinators as well as ministers, and the ESF coordinators 4, 5, 6, 7, 9, and 10 are here present, or at least most are. Mr. Plantain will join us as soon as he gets out of his other meeting in order to provide the relevant updates. The EOC is constantly updating its data recording and presentation of the epidemiological information so that we can better forecast the next steps moving forward. As a result of those meetings, the multidisciplinary task force was formed, and the proposals were made to government regarding guidelines as well as a phased approach to the reopening of different sectors within our community. I had mentioned earlier that the state of emergency would end on May 17th, and I think many people, and that we would begin the de-escalation period. However, the proposal coming out of the EOC is for the state of emergency to continue even as we de-escalate in order to be able to properly assess and, if necessary, if we need to make adjustments, make those. So while we will see the opening of more businesses, of course, under very strict guidelines as has been proposed by the EOC, and especially on the recommendation of the multidisciplinary task force, which also comprise of the main persons that you see on the panel with me today and who can answer any and all questions related to such. The government is finalizing the plans, and yes, in today's meeting of the Council of Ministers, there was an extraordinary meeting of the Council of Ministers to approve those plans. So at present, the process is being followed with the advice being forwarded on to the governor, His Excellency Governor Eugene Holiday, for his perusal, as the national decree does require co-signature of both His Excellency and myself. Additionally, we have continued to collaborate and discuss with our French counterparts on the northern side of the island as it pertains to the continued border control. Even during this period of de-escalation, we will meet again on Monday next week to finalize those discussions. And as we synchronize our de-escalation, or as they call it, deconfinement measures, both governments have shared our draft de-escalation plans, and we will be meeting to synchronize as much as possible. As a matter of fact, one of my ESF coordinators can probably update that some meetings have already taken place at that level, and now that the collectivity of St. Martin has a stronger influence, we are working with our counterparts to ensure that as much as possible, we can decrease the stress as related to the borders, crossing the borders, etc. We must always, before doing any or making any steps forward, ensure that the health situation on both sides of the island is fully under control to prevent cross-contamination and a resurgence of the COVID-19 virus. The positive cases have remained stable for some 11 days now, since we have started this state of emergency, which is a good sign. We continue to monitor the developments, and we will try to de-escalate and head towards a vision of fully reopening in July. I would like to also mention that as it pertains to our health cases, in our update from May 8th, that we can see a drop in our quarantine, we see an increase in isolation numbers as we have several tests pending, and persons with symptoms are now at 28. 4 persons are still hospitalized. Unfortunately, I must announce that the passing of the confirmed COVID-19 patient who was being cared for in the intensive care unit tent at the St. Martin Medical Center. The patient was in the ICU for some 8 days and had several underlying health conditions which also contrived to his demise. We must say that our heartfelt condolences go out to the family, friends, and colleagues who are grieving the loss. We really had hoped that we could have kept our deceased cases where it was, and we continue to pray for all families who are suffering at this time due to the loss as related to COVID or any other related conditions that have led to their death. We will continue to monitor the 4 cases that were in there. 2 were ready to go home already, but based on their home situation have not been released. And we would like to also note that our recovered numbers have gone up to 46 and our active cases down to 15. So with this, I would like to pass the word, with your permission, back to you.
Thank you, Prime Minister, for your opening remarks. At this time, I would like to invite ESF 6 Coordinator and Head of Public Health, Ms. Fenna Arnell. Fenna, you have the floor.
Thank you, Relaika. Good afternoon to all viewers. As Pia already indicated, the latest statistics as of yesterday, May 9th, I will not reiterate the numbers as they were already provided. I will give an update on the community outreach program up until May 7th, 2020. Today, the team was in Belvedere, Bishop Hill, and they started in Middle Region. In total, the community volunteers canvassed 5 districts. In these districts, they went door to door by 1,915 homes in approximately 14 areas, 14 neighborhoods. These households consisted of 5,132 persons. When speaking to the persons at those households, the community volunteers identified 36 persons with self-reported symptoms. During a follow-up phone call by CPS staff with these 36 persons, 21 reported respiratory symptoms and were subsequently tested. 1 person tested positive for COVID-19 and 3 results are pending. 10 indicated that they did not have any symptoms. 3 persons had chronic conditions and were advised to contact their family physician. And 2 persons refused to be tested, and after repeated follow-up phone calls, still refused to be tested. These persons are, however, advised and are being monitored to isolate themselves. Updates based on the prerequisites as outlined by EDVM and WHO. St. Martin has ensured that we have received a sufficient testing capacity. As such, our turnaround time now for receiving results has decreased to 24 hours, which is in line with the other testing labs regionally and internationally. Our monitoring system has increased significantly as CPS has increased its capacity and volunteers who are actively in contact with our isolated and quarantined persons. Our curative capacity has been increased with the dedicated pavilion and hospitainer at SMMC. They are both exclusively being used right now to treat COVID-19 positive patients. With the information forthcoming from our health frontline workers over the past week, fortunately, while CPS continues to test persons, there have been no new positives. Adherence to the general precautionary measures. A task force consisting of representatives of key ESF groups has designed sector-specific guidelines in order to ensure that the business community can safely reopen. As the Honorable Prime Minister just indicated, a de-escalation plan, including the general guidelines, was presented to the EOC for approval. In order to prevent a resurgence of cases and the public at large, the business community, and the public at large are urged to ensure that they adhere to these guidelines. The basic rules remain physical distancing of at least 2 meters, the proper use of masks in public, and businesses are urged to take all precautionary measures to protect their staff and clients in their establishments, as well as those outside awaiting the opportunity to enter the establishment. The safest precaution is, of course, remaining in the confinement of your safe homes. ESF 6, along with the other ESFs, will continue to develop and update the already established guidelines for businesses to ensure reopening that promotes a secure or secures the possibility for their clients to practice the safe behavior, preventing a potential spread. As it relates to our hurricane preparedness, we have commenced, ESF 6 has commenced its hurricane preparedness process last week. A meeting took place with SMMC and ESF 3 specifically to identify their needs as it pertains to the COVID-19 dedicated areas that were temporarily placed outside of the facility. Thank you, Ralaika.
Thank you, Fenna, for your opening remarks. At this time, I would like to invite ESF 7 Coordinator and the Secretary General of the Ministry of Public Health, Social Development and Labor, Ms. Joy Arnell. Joy, you have the floor.
Ralaika, good afternoon, everyone. Good afternoon, Prime Minister, fellow panelists, and audience. Good afternoon. I just would like to update the general public that the food distribution continues. We have distributed quite a number of boxes now. We've done 4,000 something if you include all of the different organizations. We are thankful for the organizations that continue to get donations from the different businesses and on a daily basis continue to go out in the community to ensure that food is delivered to persons who are most in need and cannot go to the supermarkets to purchase such. It is good for the general public to understand that this is a collaborative effort. We are working together, that it is not so that if they got a box from government, they won't necessarily, that they would also get one from the different organizations. We are trying our best to reach everyone. So it means that if you already have one, whether it is from K1, from Freegan Foods, from Red Cross, from Dorian and her group, that this is all part of the process of ensuring that persons have food. We are also looking forward to the promised donation that is coming from the Netherlands, so we could continue to expand our program as it pertains to food distribution. And we're looking at some of the UN organizations to see how we can best prepare as we continue to go forward, and of course also preparing for the upcoming hurricane season. As such, that's the update I have at this moment. And if there are any questions, I'll be happy to answer.
Thank you, Joy, for your opening remarks. At this time, I would like to invite ESF 10 Coordinator and Secretary General of the Ministry of Tourism, Economic Affairs, Transport, and Telecommunication, Miguel De Weaver, to address you. Miguel, you have the floor. Can you kindly unmute your mic, please?
I was trying not to forget her now. Sorry about that. Good evening, Honorable Prime Minister, colleagues, viewers, and the media. Thank you for joining us today. As mentioned by the Prime Minister, we have reached a point where many of us have been longing for, namely the gradual reopening or relaxing of our restrictions of business closures. The PM has already indicated that they're in the process of discussing the finalization of the de-escalation plan, and with this relaxing of some, which is the relaxing of some of the restrictions, I would like to stress the need to remember that we are going to a quote-unquote new normal, whereby social distancing will be the norm. For this reason, we have developed guidelines as indicated that businesses should follow, should adhere to, and should insist that they also use and apply for themselves, their employees, and their customers. We cannot let down our guards. We have to maintain the practices of, amongst others, maintaining at least 2 meters from each other, from everyone, meaning employers from the employees from the customers and the clients, employees from amongst each other, from themselves. 2, ensure and monitor that no employees come to work sick, ensure that hygienic practices are enforced at all times, and ensure that to sanitize the business frequently, especially in common places where people touch a lot. These are merely a few examples of the best practices that each and every business should follow to keep our community safe, so that we do not revert back to lockdowns, where we will again be without jobs, income, and more setbacks. Each and every one of us has to take it upon ourselves, should embrace the responsibility, and to ensure that we maintain these simple but effective measures to make life better for all of us. I make a special appeal to everyone in our community to continue the good practices that we've been executing to reduce and crush this curve within a relatively short period of time. It is mainly because of these actions and practices of each and every one of us is the reason why we can slowly reopen. We cannot and should not take for granted the speed in which this was achieved when many other countries, which we are significantly dependent upon, are struggling to get their situation under control. Specifically, we would love and can't wait to see our main tourism source market, such as the United States, resolve its problems with COVID. Our economy, and many economies for that matter, are dependent upon them. In the interim, we have decided, and given the improvement of our COVID situation in Zimbabwe, that we can proceed with a phased reopening to allow for additional economic activity to take place in the interim. We continue to work on plans and revised protocols for the reopening of the airport and the harbor to ensure that once the industries in various countries feel it is safe to open our borders, that we will be ready to receive them openly and safely. In closing, we are aware that we are all anxious and excited to return to the old normal, meaning going back to how things were, the economy being completely open. But we ask for a little more patience to ensure that we open, but with a phased approach to minimize and ensure that we don't have a resurgence of cases or a second wave. This needs to remain front and central of all our actions in as much as possible. I thank you.
Thank you, SG DeWeaver, for your opening remarks. If you've just joined us, you are watching the virtual EOC press conference for today, Saturday, May 9th, 2020. Thank you for joining us. We now move on to the question and answer session. I would like to inform the media that for question purposes, we do have ESF 5 Coordinator, Chief of Police Carl John, and National Disaster Coordinator, as well as ESF 4 Coordinator, Fire Chief Clive Richardson. I would first like to call on BB Shaw of SMN News. You have the floor.
Rolika, if I may,
Afternoon.
before BB starts.
Okay, BB, before you start, Prime Minister would like to add. Prime Minister, you have the floor.
Yes, I had expected, knowing Miguel, that he would have shared at least the phase 1. We are currently what the multidisciplinary work group has come up with several phases of implementation of the de-escalation. So in allowances for businesses to open, I was literally here applauding all of his encouraging words to the business community and to the general public in how they should be behaving moving forward. But I would like to mention that after the exercise of creating that criteria system and scoring within the multidisciplinary group, we have been able to add a few cases, a few businesses, which have been actually crying out for over the past few weeks to be able to open in this week. So the first phase will continue as of this week up until May 18th, when the second phase will start of the de-escalation. More details will come pertaining to phases 2, 3, and or 4 if necessary. But I would like to at least inform the general public which businesses for this week will be able to open as long as they live up to the criteria as has been established and the guidelines. So construction companies, I know everyone will be happy to hear that so that they can get back on board in terms of fixing their homes, the renting and leasing of heavy machinery and equipment, which is relevant to that, of course. Restaurants will be able to be open for pickup, delivery, and drive-through only. I've received many, many requests for restaurants, so I know that also will be a group that is happy to reopen, and persons will be happy to be able to get back on that. So only for pickup, delivery, and drive-through. Also allowed to be open is, we had already mentioned banks, but also financial services, not those that require or that are only for money transfer, however, but other financial services will also be able to open. Textiles, seamstresses, tailors, and shoe repair, and consulting services, as well as accounting services. These all fall within the same realm as the legal and notarial services, which were already open, and we will continue to encourage, especially the last two mentioned, to work by appointment only and avoid walking-ins and overcrowding. Textiles, seamstresses, tailors, etc., they would also have to live up to the guidelines and criteria as set forth. Landscaping has been added as well. And as a result of us having construction, of course, hardware stores, which were already open for delivery, now can also arrange for curbside pickup. And we're looking at in phase 2, the following week, where the general public will also be able to visit that. Horticulture is also for curbside pickup and delivery. So that is like the larger landscaping companies. And the sale of auto and marine parts also for curbside pickup and delivery only. Essential services, including ZBOs, are also of government, are also allowed, mostly by appointment only. And the unions, which were not mentioned before, have joined a group of phase 1 companies. All of the other companies that had been already deemed to be open will continue to be opened, and I've only highlighted the ones that have come on, because all of these companies together, after much evaluation by our multidisciplinary work group, our task force, has been deemed to be able to be open in phase 1, which we are currently in and have been in for the past 2 weeks. So that is an update where that is concerned. The opening hours that will be proposed for this week too, I think many will be happy to know, is Monday to Friday, so not just 3 days. So there's absolutely no reason to rush out. All of these businesses mentioned and the ones that were already open will have the opportunity to be open all 5 days of the work week, and deliveries will continue to be possible through Saturday as well, excluding holidays. Of course, all of the other rules that were mentioned before, 8 to 10 a.m. reserved for persons with disabilities, the elderly, and pregnant women, and also government services that are made by appointment This will be, all of the other services specific will be published separately. And I was told I missed a section. Yes, let me go back to my file. As I mentioned before, and as I believe Miguel mentioned, though the EOC has taken a decision that these businesses can be opened, they must meet the criteria to do so. And of course, they have the right to refuse to open as well if they do not have all of the things in place to be able to do so, all the measures to protect in place. So daycare institutes and early childhood development centers have been deemed as that they are also able to be opened. I think that section was missed under the educational institutes. I think here I covered everything. If I miss anything, anybody else from the ESF, or especially from the multidisciplinary group, can jump right in. Waivers will still be used for persons needing to cross the border. The prefet and the email and the website will be published as per usual. It's the same as before. You should request up to 48 hours in advance. And similarly, those coming to Chief John and myself, 24 to 48 hours in advance for urgent medical or for medical appointments, etc. If there is urgency, of course, please inform right away if it is urgent. Social distancing will be strictly enforced, and wearing protective face gear also. And in particular, if persons cannot maintain a 1.5 to 2 meter distance, the health sector also recommends that you have face shields as well as the mask. No zoning will take place as of the change of the state of emergency moving forward. So that will also cease to be controlled moving forward. I think now, Miguel, I really expected you to do all of that.
Well, I didn't want to. I didn't know how to wait to the decision with the governor deciding to make it formal. That's why.
Well, so far those changes are not going to be a challenge. We are more looking at the feasibility of the rest of the phases. And so this part, I believe we could share with the general public, as that is in the week upcoming. The other changes are in the weeks following, and therefore we have more time to inform the public in a timely manner if any changes have to be made in the following phases, so the phases 2, 3, and so on. So I think it is important for the general public and for those businesses to be able to think ahead in the week coming. And we would like to, of course, with the passing of our decree, inform so that people can plan ahead for week 2, for phases 2 and 3 as well. So as we go down into June. Thank you, Relika, and my apologies again for interrupting the flow.
Thank you, Prime Minister, for the update on the extension of the businesses. I would now like to invite Bibi Shah of SMN News. You have the floor.
Good afternoon, and let me start off right where the Prime Minister cut off. Prime Minister, I got the list. I managed to take the list of the businesses that you mentioned. But what I'd like to ask you is that will this, the new regulation or the phase 1 of the reopening start exactly on the 17th of May or else of this new week, the 11th? What date exactly you're starting this new implementation? And can you also highlight some of the businesses that are not going to be open or allowed to be open in this phase? And I want to zoom in on places like the gym, insurance company, barbers, hairdressers. Are these people going to be allowed to open? Can you give us some of that information and exactly the implementation date for phase 1?
Thank you, Bibi.
Thank you for that question. I thought I'd made it clear that we are currently already in phase 1, and phase 1 will continue as we extend the state of emergency from the 11th to the 18th of May. So we expect phase 1 to run in this coming week up until the 18th of May. That was actually what we had asked for initially, but based on the recommendations, especially from the health aspect, to keep the state of emergency in place to be able to control what is happening during the de-escalation, and even as we give our population more opportunity to move around, to give the police, to give the law enforcement, the inspectors, the ability to carry out the necessary inspections to uphold the de-escalation, and for us to be able to evaluate the de-escalation each phase to decide whether we will extend that phase a little longer than planned or not. So I can tell you for now, each phase is planned for 2 weeks. We have been in this phase already, so this phase is phasing out. It is just that some of the businesses were not in it prior to this week, and so we making sure that they can start this week as long as they are ready, and those that aren't ready can start later. It doesn't matter really. We are just informing as government what can be allowed. However, it will not be allowed if all measures are not in place. And if you are open and we come and the inspections do not come up to the level, then you will be shut down until you can meet the necessary measures as has been put in place to protect the employees as well as the clients who will be making use of these services. You asked about gym. I can tell you the proposal, let me see what phase gym fall in. What was the other question? The gym and what else?
The barbershops, insurance companies, hairdressers, salons. Those are the questions we are getting a lot of text. Okay, these are the companies we are getting, people we are getting a lot of messages from. Questions are being asked. So that's why I asked specifically for barbers, hairdressers, gyms, like those.
I believe insurance companies, consulting, accounting companies, all of those are in phase one. Barbershops would not be in phase one and not even in phase two. I believe they are further down in phase three as the proposal stands. And we will be expressing clearly once the national decree as it is in effect what will be allowed in the phases. So I would prefer if you don't ask what else will be allowed or is not allowed, note that what is allowed and only those will be allowed during phase one, which ends on the 18th of May.
Thank you, Prime Minister. Thank you, Bibi, for that question. I would now like to call on Judy Fitzpatrick of the Daily Herald. You have the floor.
Thank you, and a very good afternoon to everyone. Prime Minister, I have one clarification and one question. Maybe I missed it. I did hear you mention in your opening remarks something about 5 days, but can you clarify that the list of businesses that you just mentioned that will be allowed to be opened next week, would that be for the 3 opening days or would that be for the entire week? Maybe I missed it, but if you can provide clarity on that. And my question is, regarding the opening in July that you mentioned in your opening remarks, will that be a full reopening of the island in terms of all categories of establishments, school borders, etc.? Thank you.
Thank you for your question, Judy. Yes, I did say that as of the 11th, our proposal is for opening on Monday, Tuesday, Wednesday, Thursday, and Friday, and for deliveries up until Saturday. So open to the public from Monday to Friday, and on Saturday also for deliveries. Full closure on Sundays, and I forgot to mention the Avon clock, the curfew at night continues from 8 p.m. to 6 a.m. So that also continues as well. So everything that was in place before continues, except that now it will be allowed for 5 days instead of 3. And I've added several businesses to which we call now our current phase 1, which we are in. The question as to what will happen in July, if our planned de-escalation happens as we plan, then we will be finalized by mid-June. in terms of allowing opening. While all of this is happening, we are allowing also in a phased manner repatriation to St. Martin to take place. That has not been fully planned out yet. We have already a group returning that will be going into quarantine in a facility. So as many as we can handle within the facility will be allowed in a phased approach also to return, because we're also getting a lot of questions as per persons requesting to come home, and mainly they go through our Foreign Affairs office, that is Office of DBB, and we will put a contact number and email address in place by next week as part of our government services, so that persons can contact us directly so we can schedule the return of local residents as we continue to de-escalate measures.
Minister, thank you, Judy, for that question. I would now like to call on Andrew Dick of TV Carib. You have the floor.
Yes, good evening. Good evening to the Prime Minister and also the rest of the panel, of course, those who are viewing. Okay, Prime Minister, quick question. So concerning the de-escalation, has Parliament been informed? Because you had some members that were saying that the members of Parliament are not being informed concerning what is happening concerning the de-escalation plan. And also, there were a number of tests that was delivered to your person from Member of Parliament Omar Otley. Still, nothing is being done concerning that. Is there a reason for this, Prime Minister?
Thank you, Mr. Dick, for your question. I forgot the first part, but let me start with the second part. The test kits that had been delivered, which are known as, I think the general public call them rapid tests, but I believe the health sector calls them something else. I can't get it to my head at the moment. They were delivered to the Ministry of Health. I was told, and I updated Parliament as well as the general public, that I would receive an evaluation as to whether they were authorized to be used, and thus far they have not been authorized to be used through our regular chain. The Inspectorate of Health has not did not give them the green light to be used. And sorry, can you remind me as to the first part of the question?
Yes, Prime Minister. The first question has to do with the Parliament being informed concerning the de-escalation.
Oh.
Yeah.
Yes, Parliament was informed on Wednesday as far as we were in the process. And no, they have not been updated thus far, but we are in the process right now of finalizing a national decree. And once that national decree is published, it will be also shared with Parliament as well as the general public.
Thank you, Prime Minister. Thank you, Andrew, for that question. I would now like to invite Jeffrey Socken of Island 92 Radar. You have the floor.
Good evening, everyone. Thank you. I'm not sure if this question is best addressed to the Prime Minister or to Police Chief John. With the upcoming changes between the north side of the island and us, I've received numerous phone calls with Dutch side residents being concerned. They own businesses on the French side, and from what they're telling me, that the French side will begin to resume business operations starting on the 11th, but they will not be permitted to cross the border to operate their business. They've all submitted the waiver form, but nothing has been approved. So I'm wondering if you could provide some clarity around how Dutch side residents who own businesses on the French side or work in businesses on the French side, how will they be able to cross the border to operate their businesses or get to their place of employment?
Dr. Stock, for that question. Chief John, Prime Minister. Chief John. If you can have your mic, please, Chief John.
Good afternoon. Thank you, Dr. Salk, for the question. As of for the Dutch side, all French nationals or people who are living on a French side that applies for any movement for the Dutch side is being signed as soon as possible. Naturally, the Prime Minister just mentioned that that should be within the 24 hours for you to get an untimely answer. For the French side, we have absolutely no control on how fast the process is. This week we had some complaints indeed about not getting an answer back from the French, and I think this is something that we will discuss in the upcoming meeting with the Préfet, to have this also done as soon as possible. But from our perspective, there is no limitations on people who needs to move to the French side to go and work.
And Chief, if I might add, is the experience that I've now gotten from several business owners is they've been told, no, you're not going to be permitted to come to the French side, and that's the way it is. That even so far, insofar as there was a teacher that was attempting to travel from Dutch side to French side and was told, sorry, no. Same thing with parents attempting to bring children to school. So I think we have a developing problem and a communication problem. So if there's something that you could do to look into that with our counterparts to the north, I think it would be most appreciated by many. Thank you.
As I mentioned, there will be in the upcoming week with the Préfet and indeed our law enforcement counterparts on the French side. And I also mentioned that we also received a few complaints, so we will definitely discuss this with our counterparts.
Thank you, Chief John. Thank you, Dr. Salk, for that question. We now move on to the second round of questions. Bibi Shah, Vesta News, you have the floor.
Thank you, Malaika. Madam Prime Minister, I will pick up where Andrew Dick left off with the rapid testing. I'll give it the name that everybody gives it, the rapid testing. What I want to ask you is rapid testing used on the best islands? And if it is used, and if you know, by the way, has this been approved by the RIVM? Because I'm being told that these islands are using rapid testing. And if it is so, and if it's the same testing or another rapid testing, why is it that St. Martin hasn't received that as yet?
Fenna, would you like to take this question?
Good afternoon, Bibi Shah. Thank you so much for that question. The entire kingdom uses the same protocol as it relates to testing. And in the BESS, it's not rapid test, it's point of care testing. Point of care testing is not being used on any islands in the Dutch kingdom. Not being used as a test to diagnose whether or not someone is positive for COVID-19. The only test that's being used within the Dutch kingdom are the PCR testing within the laboratory. Only laboratory tests are being used right now within the kingdom.
Thank you, Fenna. Thank you, Bibi, for that question. I would now like to invite Judy Fitzpatrick of the Daily Herald. You have the floor.
Thank you so much, Malaika. Will we be having another round of questions after this?
Yes, we have 3 rounds of questions today.
Thank you so much. Prime Minister, you indicated, of course, that the businesses that will be given permission to open in the coming week would have to maintain social distancing, sanitizing, distance between employers, employees and customers, etc. So, I'm just curious as to what protocols are in place for daycare centers and early childhood stimulation centers. There are usually many kids packed in one room. And, these are young kids. They hug each other, they play, they don't understand what social distancing is. So what protocols do daycare centers have to follow to ensure that social distancing will be maintained, as is the case with everywhere else?
Thank you for that question. I'd like to refer this one also to Fenna, as she and the others in this panel did form part of the multidisciplinary task force, and her area of expertise is on the health aspect, and VSI is the inspection that looks out for daycare centers. Fenna?
Thank you for that question, Judy. In discussion with the Inspectorate of Health, who is the one responsible for indeed inspecting daycare centers, he indicated to me that the policy or the guidelines to be used in the daycare centers are face shield masks, appointments for the children to be dropped off, social distancing of 2 meters for the adults. Children are basically no problem because of their strength, their ability to have a strong immune system. And all adults who come to pick up or drop off their children are to use face masks and sanitize. Thank you.
Thank you, Fenna. Thank you, Judy, for that question.
Yes, if I may add, again, that is, let's say, a sudden announcement for the daycare centers. So we do not expect that daycare centers, again, I mentioned it in the beginning, but let me reiterate that even as government announces what will be allowed, it is not that they are mandated to do so if they are not ready, if they do not have all that needs to be in place to be able to do so. So the daycare centers that want to open would have to ensure that they have that the guidelines are understood and they have followed them in order to do so. I think Fenna mentioned the contacts, etc. The criteria for scoring businesses to be open during phase 1, 2, 3, etc. is looking at the health aspect, looking at the social need and demand, looking at number 3, the economic need and demand. So as we are de-escalating and expecting persons to go to work, I want to remind that businesses, as much as possible, should do all they can to maintain as much as possible working from home. It is not that you are mandated now, everybody run and open up 100%. I know some businesses that, especially offices that cannot provide for proper social distancing in the offices, are having staggered schedules. So some within the office work in the morning, another group work in the afternoon. With more persons going out to work, the most vulnerable group is the group that needs the most care from parents is daycare. So that's why they ended up in phase 1. The next level of education would end up in phase 2, and then the next level in 3 as more and more people go out to work.
Prime Minister.
Sorry, and I would like to add as well, because of some comments that I noticed on the chat just now, regarding children probably having a low immune system. I must also indicate that the responsibility lies as well with the parents. In the event that you do have a child that is ill, of course you're advised to keep your child at home. But that's the policy of daycares in general, that when children are ill, they're requested to keep their child at home to protect the livelihood of the other children.
Thank you, Fenna.
And it is totally up to the parent to decide if they're going to send the child to the daycare once the daycare opens as well.
Thank you, Prime Minister. Thank you, Fenna, as well as Judy, for that question. Andrew Dick of TV Carib, you have the floor.
Thank you so much for a question to the Prime Minister concerning the reopening for casinos, lotteries, that sector particularly. Quite a number of persons are employed by the casinos and the lotteries. I know sometimes people don't like to talk about them because usually it's geared towards the tourists that's coming, but we know that has stopped for the meanwhile. So, but in the meantime, the casinos are looking to do something. So in your phase plans, where does that fit in as far as them reopening?
In this time of, thank you for the question. I'm trying to frame my question properly in my head before it comes out my mouth and completely gets played in the next set of jingles. In a time of economic need, I'm very happy to announce that the casinos will not be the first, second, nor third phase opened. As long as we don't have tourists, they will not be opened. We will accept that when I say, if we have the casinos open right now, that allows for our population to gamble away, especially for those with little funds, the little funds that they have. And so we're not going to make a bad situation worse by betting on a little chance to win some funds. Casinos, for the most part, should be catering to our visitors. And even so, prior to this whole COVID thing, there should have been, there's actually a restriction for how often the locals can visit those places. So as we phase in, that is not a priority for us at the moment. Government is trying to do its best to alleviate the strain and stress on as many businesses as possible with their SSRP plan, and as many as can come on board will be able to do so. I saw someone also asking why we still have a curfew as night businesses aren't open. We are restricting movement on the roads in the evening also for safety and security reasons. And until we reach to the place where we are certain that we can really release, even in our new normal, for most of the other businesses to open, we have to ensure that we can protect everyone involved. So no, casinos are not, I spoke too quickly. It's actually in phase 3. That's why Fenna was shaking her head. Wow. I really thought it was in phase 4 with the recreational activities, but it appears it's in phase 3. I take back everything I said. Those were totally my personal opinion.
Thank you, Prime Minister. Eshida Weaver, would you want to add to that? Yes, Andrew, go ahead.
The lottery, the Prime Minister didn't say anything about the lotteries.
They're both the same.
Yeah.
At the same time.
Oh, they are? Casinos and lotteries the same?
No, and they're both in the same phase.
Oh, okay, same phase. Thank you.
All right.
Thank you, Eshida Weaver. Thank you, Prime Minister. Fenna?
Can I please explain the process of the scoring of which businesses fall into which category? It's a combination of public health risk, social need, and economic need. The higher the public health, and this is not a St. Martin's scenario, this is an international scoring system that was used to determine what phases or what categories of businesses should open when, based on the economic need, social need, and the risk of public health determined at what phase you would open. So the fact that a casino falls, for instance, not going at the casinos, but the fact that a casino falls in phase 3 versus phase 4 has to do with the fact probably that the casinos they employ a great amount of people. So therefore, employability was seen as a much higher item to be focused on at that point in time. Thanks.
Thank you, Fenna. I would now like to invite Jeffrey Sokrin of Island 92 Radio. You have the floor.
Thank you very much. The first is a clarification for the Prime Minister. And I guess it's really a clarification on 2 topics. First, the opening hours for businesses that are permitted to be open. What are the published opening hours? And Prime Minister, you had alluded a little bit to a process by which returning residents could contact a particular department, schedule their return, but they will be required to quarantine for a period of time upon their return. Where is that quarantine conducted? Is that at their home or is that in a facility?
Thank you, Dr. Sock. The clarity that you sought was on quarantining. The quarantining
and the opening hours for businesses.
Yes, so the process has not started in terms of registering officially. We have received individual requests, etc. Certain businesses, SZV, in terms of their patients, we've been contacted. So that is being arranged, and the quarantining will be done within a facility. We are not running the risk unnecessarily of having persons return and reinfect large quantities of persons. So when you are granted the opportunity to return, you will have to quarantine within our designated facility for a period of 2 weeks. And the possibility to register to reach home, that hasn't been finalized yet. As soon as that is official, then I will have that published for all to be able to schedule their return.
Thank you, Prime Minister. And the opening hours for businesses that are allowed to
Yes. The opening hours remain as before as well, 8 to 6 p.m. max. 8 a.m. to 6 p.m. max.
Thank you very much.
Eshida Weaver, did you have something to add?
No. The Prime Minister answered on the opening hours.
Okay. Thank you, Dr. Sock. Thank you, Prime Minister. We now move on to the final round of questions. Bibi Shah, you have the floor.
Oh, my neck.
I have a two-part question, Relaika. Prime Minister, can you tell us exactly in which phase do you have a projection for schools? Because you say you have daycare, and I understand all that you explained with daycare. So just in what phase for school? The other thing is regarding students. We have some students in the United States that are studying. Their end of their semester begins in May. And some of these students find themselves in predicament, can't find homes, can't find housing. Are they going to be part of the students or people returning to the island? That's the first part. And as you spoke about the businesses be allowed to open additional businesses and how important it is for social distancing. We received a letter just recently about a social gathering somewhere in the Maho area where government officials participated. I mean, that letter is in all the media, and they're even asking you, Prime Minister, to investigate this. People who participated in a jump up, they were fined, but now you have so-called government officials, whether it's civil servants, whether it's politicians, participating in a social event where there were more than 30 people. This is according to a letter sent to us. Can you address that and tell me about the students, please?
Thank you for the questions. I believe the first one was on the phases whereby the other levels of schools in educational facilities would be opened. I think I mentioned that primary, again, we've had discussions with the representative of Ministry of Education, Culture, Youth and Sport, and it is going to be on an analysis basis, school by school and school board by school board, in terms of what will be allowed. Government is saying it can be allowed in the second phase for primary schools and in the third phase for secondary schools and where is it?
The university, vocational training.
And vocational training institutes in the third phase. Again, this was based on the criteria of the scoring, but does not mandate that they have to. The Minister of Education and the ministry and the school boards are determining whether that will even be necessary, seeing the time of the year. There was a discussion that we were updated on yesterday that they are looking at during those phases to have the exam candidates come back on, as we have been apprised that CXC exams will be in July. And so therefore the focus will be on the exam students. I also asked the schools to look into the students who would not have been able to follow online classes due to lack of devices and or internet to also be looked at as a second priority. And lastly, the children of frontliners who have been relying on others to take care of their children, and now with more people going back to work, may not be able to be a frontliner full time and have children to take care of as well. So based on that need, again, the rest of the population, if your child is able to follow online classes and is doing well, there should be no reason for you to rush to do that unless you are not able to take care of that child or you have to go to work, etc. So we looked at the need, the social need of having schools. Also, some schools provide food and they provide, food and counseling and all of the rest. And the children are missing that as well. So it will be on a need basis, with the priority being the exam students and as I mentioned, the other two groups of students. Parents in all cases have the right to keep their children at home if they're able to follow education, as that had been also allowed in education policy where homeschooling is concerned. And the next part of your question related to students in the United States, if they fall within study financing, then just as SZV was able to contact us to make arrangements for a group, I would expect that via the Division Study Financing, arrangements will be made once students reach to the point where they have to leave their classes, their school campuses. As you know, several had to come home prior to the lockdown for that same reason, that their schools closed down, and the same quarantining regulations, a policy will be in place for them, and they would have had to have a clear-cut agreement with CPS and the conditions for their return being the health factor. Social distancing at the reported event, just like with the Juve, investigation will be done and handled accordingly.
Thank you, Prime Minister. Thank you, Bibi, for that question. Judy Fitzpatrick, you have the floor.
Thank you very much. And I have, I believe it's two questions. Prime Minister, in your capacity as chairperson of the Emergency Operations Center and of course, Prime Minister, the Finance Minister had mentioned on Wednesday that he had submitted some recommendations and that the COM had discussed cost-cutting measures in government. My question is, apart from the additional percentage that the Council of Ministers have agreed to, what are some of the other recommendations that are in that proposal? And the second question is, right now we're getting a lot of bits and pieces of information as to what would be reopened in the second phase, in the third phase, and so forth. Has the EOC considered not just releasing what will happen in all the phases? I mean, like which businesses specifically people can expect to be opening all the phases so that, proper planning can take place ahead of time rather than just releasing in bits and pieces and, and then you have a lot of questions. Oh, when will this open? When will that open? Has the EOC considered that?
Thank you for your question, Judy. Based on, I'll start with your last question first, as it is so COVID related, and what the goal is of this actual press conference. The phases, I can show you the document that has been sent forward to be approved. Phase 1 is this, and this is phase 2. And then we have phase 3, and then we have phase 4. And all of them are additions to the previous phase. We have it prepared. We are waiting for the national decree to be signed off on. And once it is signed off on by both His Excellency and myself, it will be published in its entirety in the National Gazette. If there is any issues in having the rest published within before the expiration of our state of emergency, then we will publish what can be published, but know that there is a complete plan in place and we will divulge such as soon as we get the final approvals for it. I did mention here and there what was proposed. So we can publish what is proposed, But then if we have to make changes, then there causes confusion. We know for sure what is in phase 1 will be able to be executed because it is an addition to what already existed. There were only a few businesses that had to be added. And in fact, several of them were exercising their right already on a delivery or emergency basis, and it is just to be formalized and seeing it written there. I still don't see the insurance companies written, but guarantee you me, insurance companies also fall within personal and professional services within our categories. We have financial services, accommodations, home and auto repair, and general repair, food and beverages, medical and paramedical, educational institutes, personal and professional services, retail of goods, curbside, pickup and delivery only, other services such as suppliers of fuel, etc., which has already been there. We highlighted in bright yellow, once you will see it published, what comes new in phase 1. I do not want to share the document, as I've done in past press briefings, before it is properly approved, so I don't get any backlash as to the legalities of what we're doing, especially for phase 2, 3, and 4. And what I must reiterate is that even when we publish it, it is subject to change as we continue to monitor our COVID cases, and as long as they continue to go down, they will be executed as planned. If we see a resurgence, we may have to pull back and say stick in phase 2 a little longer or stick in phase 1 a little longer. As you've noted, the Friendside only this week started their community outreach, and they've already found a positive case. We have been doing our community outreach for 3 weeks, and in the first week, we found a positive case, but since then, over the past 11 days, none. It can still happen. So we will continue to look, we will continue to do what we have to do and maintain and mitigate the spread. And therefore, everything is subject to change, but we also felt it was imperative to give a good overview moving forward, which is the intention and the plan.
PM,
and the first part of your question, oh yes, Miguel, go ahead.
I just wanted to add too, because you raised the issue of insurance. It is in phase 1 under point number 24. So insurance activities is there under financial services right on the top on the right hand side. So.
Yes, I missed it. And it wasn't highlighted as a new service, while I think it wasn't really open like that. It was more on a need basis, emergency.
On an appointment basis. And now it can be open to the public.
Right.
How would you propose?
So the next question, or the first question, regarding the finance minister's SSRP and the need for the cost-cutting measures, whereby we as a council of ministers agreed to cut our own salaries by another 5%, which would be a total of 20 from our take-home. The recommendations are many and are being discussed with the unions at the moment. It is unfortunate that the unions choose to divulge in information in attempt, I'm assuming, I don't know if it's an attempt, but I don't think they would think it would have any other effect but to rile people up. I would like to, give the Council of Ministers the opportunity to properly elaborate on that, as it is a whole topic in and of itself. And in our extraordinary meeting this afternoon, that we did discuss that this needed to be brought over to the public and that we should share the information. But it is Saturday, and I don't know if it will happen tomorrow or Monday, but that information will be forthcoming. As you know, our government strives on transparency, and we felt we were having a meeting with unions that had to go back and have discussions with their membership, not have a public debate about something that had not yet been discussed with the membership, and hopefully that the complete proposal is presented, including the aspect whereby, and it was only presented as a discussion, they had not yet received it in writing. And our next meeting is to be able to present it in writing, as well as receive recommendations from the unions, as the government has taken every opportunity to cut where could be cut in our already meager budget. We cut all the travel as much as possible, but we also have extra expensive. So a lot of the things that we are cutting from travel, etc., have to go over to COVID-related expenses in anticipation of not having yet received any COVID-19 support from the Netherlands, which is a loan anyways. So in an effort to ensure that Government St. Martin presents that we are doing everything within our power to help ourselves, we are looking at cost-cutting measures across the board, just like we cut our own salaries. So with that, I would like to leave that rest until the Council of Ministers is able to issue its own press release on this topic.
Thank you, Prime Minister. Thank you, Judy, for that question. I would now like to invite Andrew Dick of TV Carib. You have the floor.
Thank you, Roraika. Concerning the project, just a clarification, the construction projects, is there a limit as to how many workers can be on a work site? And going into my question, public transportation, have any meetings taken place with the public transportation sector concerning, of course, bringing those who needs to go to those many businesses that will be opening this week? As far as their social distancing, what will be the new policy concerning amount of persons allowed in a bus and so on?
Okay. PM, if I may, on the issue of public transportation, yes, we have been in discussions with the Bus Association and we are grateful for their support. They have indicated during the course of this weekend, they will provide us with a list of all of the bus drivers that will be willing to provide and participate in providing transportation during this time. They have agreed to the conditions under which we have in our policy guidelines with respect to the protocol, the sanitation, wearing of masks, and the capacity, where we have agreed that they will be doing it. It would most likely start in phase 2, which is next week Monday. So this week we will work out the details with them, but they will be working at 50%, they'll be running at 50% capacity of the bus, which means that person will basically be sitting on each row. They'll be sitting on the extreme opposite sides, on the end of the rows at each row. So that will be the basis on which they can provide public transportation. And I think we are asking the public to make sure that they also adhere to those standards as well, because we are trying to keep the situation under control and prevent any resurgence. And that's the reason why we have buses that will not be able to run at 100%. And it's only basically it's 2 persons per row and everybody sit on the extreme side of the bus. So that's what the plan we have. We're also looking into them assisting with trying to cover all of the areas to make sure that they cover the routes to provide transportation to all of the public.
Thank you, SG De Weaver. Thank you, Andrew, for that question.
But concerning my first clarification, it wasn't clarified concerning the amount of persons allowed on a construction project.
We don't have a specific number per se, but what we have, we maintain the general guidelines of social distancing of at least 2 meters, as well as wearing protective gear, mask, and as much as possible. But and depending on the type of work they're doing, usually they also are wearing mask and stuff like that. So because of the dust. So, but the usual standard 2 meter distancing and as much as possible, and wearing of mask and are highly recommended and required.
Thank you, SG De Weaver. Thank you, Andrew, for that question. Final question now, Jeffrey Sarkin of Island 92. Dr. Sark, you have the floor.
Thank you, Orlika. Madam Prime Minister, if you could just clarify, you said retail of goods and services for curbside pickup or delivery was permissible. And then my question might be best addressed to Secretary General De Weaver. Airlines are kind of one of our lifebloods here on the island for sure. And they probably are not really all that willing to start to schedule flights till we've got some realistic and clear guidelines in place. What's the timeline and the plan for allowing tourists to return to the island, and what criteria will we put on that return?
Thank you for the question. Mr. Sack. I think I have to be straightforward with this question because, as you know, or as you may know, the U.S. government has put a no-sale order on the cruising industry until August. And I know you asked about the stayover. Go ahead. And so. Yeah. Okay. Making sure that's it. Yeah. So that's one of the areas. So we know that we have some time, and we're working with the harbor on it, and we're also working with the airport. We just received last week a IATA document with some guidelines that the airline industry will be using, because one of the things we want to make sure is that it's safe to open and it's safe to travel. And IATA has come with some guidelines, and the airport, we have discussed them with the airport. The airport is revising their protocols to make sure that what they do as well when the passengers come, that we are also protected, and we also doing the checking of the passengers, because we don't want to open our borders and we don't know if there are persons coming that may be sick, and then we have a problem. So I think the industry itself is still in the middle of those discussions, and we are also with those discussions next week. As a matter of fact, we're going to have a meeting with the revised protocols of the airport, along with the public health officials, and we're going to sit to make sure that those protocols, revised protocols, enhanced protocols, are sufficient from a public health standpoint, or needs to be updated. And then we will then, with that as a basis, then we will be able to then have a firm discussion with the airlines to make sure that whenever we do decide to open the borders, that it will be pretty much safe to do that. And of course, there will always be this risk until this situation is under control, because in the U.S. it's still a big issue, and it's at this time it's very uncertain as to how things will develop, but we want to make sure that obviously it's safe for everyone.
Thank you, SG Weaver. Thank you, Dr. Sock. I think you also had a clarification from Prime Minister.
Yes, thank you.
I still need to clarify something.
I can repeat the question, Prime Minister. If that.
And I sharp this hour tonight.
I understand the feeling. You had said, and I want to make sure I use the words correct. You said retail of goods was permissible for curbside and delivery services starting this week. So if I had a flower shop and I wanted to do curbside or delivery, that would be permissible, as an example.
I'm trying to find where it is. Miguel, help me.
Yeah, it's 34.
34, 38. I said retail of goods. Under the section retail of goods, we have hardware stores, horticulture, baby and maternity stores were already there for delivery only. Electronic stores were only there for delivery only, and that is still maintained. And sale of auto and marine parts, as well as the first two I mentioned, hardware and horticulture, have been added as of this week and will be allowed for curbside pickup. So actually hardware was there as well for delivery only, but it has been added due to the high demand and need based on the hurricane preparedness for curbside pickup as well. And sale of auto and marine parts. A lot of people are requesting to repair their boats. People, even though we've said that for emergencies, if you need parts, etc., it's allowed, so as not to have a rush down. And if you needed emergency service for your car breaks down, etc., or to avoid your car breaking down, all of that was allowed. But a lot of people, even businesses, weren't sure about it. And we didn't really want to make an announcement that said, yeah, go ahead and open, because these are the places we were ending up having queues as well. And we were still very heavily into our maintaining that limited movement was the order of the day. So while we're allowing more movement, we are allowing for curbside pickup and delivery of car parts, marine parts, of hardware store materials and horticulture, so plants and the like, etc. Right, Miguel? I got it right?
Yes, and which would
Okay.
mean, alluding to the question that Mr. Sack asked, under horticulture, you can add the flower shops that they can do that under, because it's all
As
related
a
to
matter of
plants.
fact, Miguel, let's just let them know that flower shops were given leeway even in this week, because we knew that a celebration was coming up tomorrow, to allow for deliveries. So they will be allowed to deliver, and they know this. I asked Miguel to individually call the registered businesses, because we didn't want to create we allow them to put out their ads, and therefore all the flower shops on the dot side have the ability. No, you're not getting an ability to deliver on the front side, or vice versa. That's not considered a high need. We have flower shops on this side, and if you really must treat your mom, do so via the Dutch businesses, so that we can maintain as little as possible stress at the borders during this time. We will soon, I am sure, go over to less strict and or no border controls, but that must be agreed by on both sides. Yes? Is that clear now, Dr. Sock?
Thank you so much, guys. I appreciate it.
So the other retail stores will get an opportunity in phase 2. I'm not seeing, yes. For walk-ins, even all that were listed before, including stationery, books, school supplies, etc., will also be allowed in phase 2. Is being proposed, to be allowed in phase 2, with them being allowed for walk-ins, not just for delivery, etc. But if I were you, I would continue as much as possible to make use of delivery if you feel unsafe.
And I'm pretty sure, because I know there's a lot of questions, for example, on the personal services like barbershop and hair salons, and they will be coming in, I think, in phase 3. So I think for people to plan for that as well, with some conditions that they take protective gears and stuff like that.
Thank you, Ashita Weaver. Thank you, Prime Minister. Thank you, Dr. Stock, for that question as well. That does bring us to the end of the question and answer session. The floor is closed. I would like to once again thank the members of the media for taking part in this EOC press conference. Prime Minister?
I have closing remarks.
I was going to allow everyone to give their closing remarks.
Okay.
I would now like to invite the EOC panelists to provide their closing remarks, starting with ESF 6 Coordinator and Head of Public Health, Ms. Van Arnau.
Thank you, Rolika. I would first of all like to extend advanced Mother's Day greetings to all the mothers. I would also like to thank the general public and business community for doing their utmost to adhere to the general guidelines. I highlight the general guidelines for businesses. I'll start by indicating wearing of masks, distance of 2 meters between all persons, including employees and visitors. Implementation of sanitation stations in entrance and throughout the business in strategic locations. Sanitation of common touched areas and equipment. Wearing of protective shields in the event 2 meters distance for service rendering is not possible, which will also be the case of a barbershop. One-way aisle and keeping social distancing. Limiting persons in the establishment to ensure social distancing at all times. Marking barricades on the floor to ensure social distancing. Plexiglass to protect your workers and your shoppers. Clear and visible signage with COVID-19 directives. General guidelines for customers and shoppers. Again, wearing masks and ensure to have all personal sanitation at all times. Adhere to the social distancing of 2 meters or 6 feet. Ensure behavior promotes personal safety as well as that your own personal as well as that of others. No handshaking, no hugging, no kissing, no physical contact. As coordinator for public health, I cannot reiterate enough the importance of practicing proper hygiene and social distancing. As we de-escalate the risks exist that may return to old habits. But it's important to take note that this behavior is the new norm. Please remember, that CPS is still in the process of assessing the situation community through the outreach community program. Until that has been finalized, therefore, we're not yet even certain if all persons experiencing flu-like symptoms have been tested. Because of this, the movement of people should still be limited until we can declare that we can clearly declare that we're out of the woods. Take responsibility for your behavior and demand at all times that your social space is respected. But most of remember, you are safest at home. Thank you, Ralaika.
Thank you, Fenna, for your closing remarks. I would now like to invite ESF 7 Coordinator and Secretary General of the Ministry of Public Health, Social Development and Labor, Joy Arnell. Joy, you have the floor.
Thank you, Ralaika. I too would like to wish all mothers a happy Mother's Day. I ask the community to continue to use creative ways to reach out to others within the community, also the mothers. We will not want to obstruct the measures that are in place. I think Fenna Arnell really presented the different measures in an appropriate manner, and I would want to stress that we continue to adhere to this. At the same time, I want to continue to thank all the organizations that are out in the field every single day, from early morning until the evening, providing assistance, providing food to the public, to the general public, and for them to rest assured that we are looking for other ways to ensure that we can bring food, some more food to you. I understand the situation. We do whatever we can as effective as possible to ensure that we can take care of the general public. Thank you, Ralaika.
Thank you, SG Joy Arnell, for your closing remarks. I would now like to invite ESF 10 Coordinator and Secretary General of the Ministry of Tourism, Economic Affairs, Transport and Telecommunication, Miguel de Weaver, to provide his closing remarks.
Thank you, Ralaika. And first, similarly, I would like to congratulate all the mothers on the advanced Mother's Day celebrations for tomorrow. You are the rock, the basis. So we truly appreciate you, and we give you thanks for everything that you do. Secondly, as soon as the decision is made regarding the de-escalation, in that decision making, there are guidelines that will be published for all the business to use as a basis to be able to prepare. The hardware stores are going to be able to be open pretty soon to the public, but you can do your ordering online and do your curbside pickup this week. Make use of the opportunity, please, to get ready. Become familiar with the document and have somebody help you. We have a matter of fact, we've already kind of set up an email address that they can pose questions. It's taskforce@stmartingov.org, St. Martin, SINT. So it's taskforce@stmartingov.org. If you have any questions on that site, when the publication is done, you will also see all of the businesses in the different phases. So everyone will be able to see more or less when their type of business will be able to open. So then you can then make all the necessary preparations before and in advance. Secondly, I want to also encourage and continue to encourage persons to sign up for the online banking, for the online GB account, payments online as much as possible so that you don't have to go into those lines and crowds, and protect yourself, be safe, for the kids to help their parents. So I want to continue to encourage that. I want to also encourage the persons to be able to, now that more businesses are open, now that they're able to shop more days, they can spread out. They don't have to do all the shopping all on one day. You have many different stores open. You can have many different times of the day. So to be able to make sure that you don't have to be in large groups, because now it's going to go to a lot more, let's say, normal. And lastly, I want to ask and tell the population that we have come this far because of them. We have come this far in minimizing this problem in a short period of time because of our behavior and our practices. And I want to encourage them to continue to do that. That is the only way that we will be able to beat this going forward. And if this is our new norm, it will become our norm. And to continue to do this in these practices, and I think we will be all right. And that's it for me. Thanks.
Thank you, SG de Weaver, for those closing remarks. I would now like to invite ESF 5 Coordinator, Chief of Police, Carl John.
Thank you, Rolik. I want to join the others in wishing all the mothers a very pleasant Mother's Day tomorrow. One of the good things that COVID brought along was that families more together in the past weeks. So I think it will be an enjoyable one. With the relaxing or partial relaxing of the COVID measures, I want to caution that next to health safety issues or health safety measures that we have to adhere to, with the relaxing, we also have to keep in mind the safety measures that have to take place. With that said, we have to be responsible citizens, proactive in protecting ourselves and belongings, making sure that we have all measures in place for visitors to our establishments, and I mean safety measures. We should not be moving around with extra cash, too much money, only money needed. We should make use of and move around. Try to make more use of your bank card, your credit card, your debit card. Make sure that all systems are working when it comes to safety. One of the requirements now is most of the times that people have to come to your establishment with mask. That makes it right away difficult to keep safe. Note that everyone that are in the criminal circuit also will make use of the mask to do their activities. Let me say that. So I want to ask everyone to be very, very vigilant in the coming days. Anything that is out of the normal, and the normal is social distancing measures. If at a certain moment you know that groups are coming to your establishment together, that is out of the normal. So please have the 911 number on speed dial. Be ready to give us a call. We will change our focus a bit on how we did law enforcement the last few days. It will guide more to the activity that's going on. So we will guide more to all establishments and businesses that are open to try to keep everyone safe in the coming days. Thank you and have a nice evening.
Thank you, Chief John, for your closing remarks. I would now like to invite National Disaster Coordinator and ESF4 Coordinator, Fire Chief Clive Richardson, to give his closing remarks.
Good evening, Nolaika, and good evening to the population of St. Martin. I would also like to join my colleagues in wishing all mothers a happy Mother's Day. Also, I would like to thank the population of St. Martin for their assistance and their agreeing to follow the rules and regulations pertaining to safety and health to help lowering the curve. And we like to request that we continue doing so that we can continue lowering the curve. I would also like to draw to attention that as we are still dealing with the COVID situation, that within the next 3 weeks, we are also going into the hurricane season, and we are busy with the preparedness for the hurricane season. All hands on deck. I would also like to inform all the Apple users that the disaster app is now also available in the Apple Store. You can find it under Disaster Prep, one word, St. Martin, and it will be updated as we go into the hurricane season. Again, I would like to thank each and everybody for their helping us lower the curve, and let us continue doing so. And thank you, Nolaika. Have a good evening.
Thank you, Fire Chief Richardson, for your closing remarks. I would now like to invite the Honorable Prime Minister of St. Martin, Sylvia Jacobs, to provide you with her closing remarks. Prime Minister, you have the floor.
Thank you so much, Rolika. I as the mother of the group, take this opportunity also to wish each and every person within the sound of my voice who is a mother or who plays that mother role for anyone a happy, happy, happy Mother's Day. Also to all of you who have mothers, make sure that you make your mothers feel special. Though we are still in the lockdown, in the sense that you cannot go as you please to hug and kiss your mom. There are so many ways you can show love. I received my basket of goods of vegetables and fruits, and which were delivered to my door. And I think that was one of the best gifts. It's a gift that is practical. We need to eat, and it is healthy. We have also reopened for delivery the flower shops. There's that opportunity. Next week, restaurants will be able to deliver. You can order something special to be delivered during the week to that special one who has been cooking for you for so long and cooking for others. It's a time where we have to be creative and utilize our social media to enjoy and celebrate, because as long as there is life, there is opportunity. So I would like to thank my panelists also for the opportunity to share the changes that are coming, the guidelines, and the reiteration that one of them made, that our behavior is what has brought it down. Rules and regulations are there, but it is your compliance that has brought down the active cases. They continue to decrease. And though today we are sad to mention that one more person has passed as a result of COVID-19, we have to really stress on health. We have to use this opportunity while the earth is breathing, while we are safe at home. For the most part, most of us are safe at home, that we in the future, in this new normal, look for ways to continue to take care of ourselves, or even take care of ourselves better, so that we are less susceptible to the very harsh realities of these type of pandemics. I believe that as a society, we have the opportunity now to right some wrongs, and together we can, together we will. I heard another panelist mention responsibility, and I think the responsibility and the discipline lies with us, to ourselves, to our loved ones, and throughout the community. We are as strong as the weakest link. Let me repeat that. I was told this while I was a volleyball player in college. We are as strong as the weakest link. The team cannot win until the strongest lift up the weakest. And therefore, we are looking and thanking again, as Joy mentioned, all those in the community who continue to look out for our most vulnerable. By us cutting what we can receive, we are able to pay out to those who will not receive anything. And we are asking for assistance, but they always say, try your best to help yourself. And so we are striving toward being more resilient and standing on our feet. Let us start by taking all the necessary measures to help ourselves. Something that was shared with me today that I would like to share with others. As governments are trying to figure out how to ease back into a new normal, please remember, some people don't agree with the suggested reopening. That's okay. Be kind. Some people are still planning to stay at home. That's definitely okay. Be kind. Some people are scared of getting the virus and a second wave happening. That's okay. Be kind. Some are sighing with relief to go back to work, knowing they may possibly save their business or their homes and are now going to be able to feed their families. That's okay. Be kind and also be safe. Some are thankful that they can finally have that surgery that they put off. That's right. Be kind. Some will be able to attend interviews for jobs that they have been waiting to get after weeks without a job. That's okay. Be kind. Some people will rush out to get their hair or nails done. Not in phase one though. That's okay. Be kind. We each have a different story. If you need to stay at home, stay home. But be kind. Don't be judgmental. If you need to go out, just respect others when in public and be kind. Don't judge fellow humans because you are not in their story. Let me repeat that part. Don't judge humans because you are not in their story. We are all in a different financial and mental state than where we were months ago. So remember, in all of this, be kind. And they said copy and paste this. And so I wanted to share it because I thought it was very helpful to me, and I'm sure it will be very helpful to others. So all of the changes will be published on our website. Stay safe, St. Martin. I'm not going to go into the whole spiel, but do know that we are blessed and we are doing everything, and together we are stronger. Have a blessed day tomorrow. Have a blessed day as we move into our new normal and de-escalate and continue to de-escalate, because we will behave accordingly. Have a blessed day.
Thank you, Prime Minister, for your closing remarks. Honorable Prime Minister, EOC members, members of the media, radio listeners, and online viewers, this does bring us to the end of this live press conference for this evening, Friday, May 9th, Saturday, May 9th, 2020. As mentioned by the Prime Minister, for rebroadcast, tune in to St. Martin Cable TV via St. Martin Gov Radio 107.9 FM, the official Facebook page of the Government of St. Martin, and the YouTube channel Government of St. Martin. For video on demand, log on to the official government's website at stmartingov.org. On behalf of the Department of Communication and the Government of St. Martin, I'm Rolika Roach, and wishing everyone a pleasant evening further.